Hello, we're doing the third and the last part of Calcarea Carb today. We've been studying this remedy from Dr. N.M. Choudhuri's Materia Medica, and we've already done with part 1 and part 2, which has covered the maximum points about Calcarea Carb. And today we're going to be learning some interesting symptoms related to the pregnancy, urinary organs, respiratory organs, fever of Calcarea Carb. So let's start with the urinary organs first. So when Dr. N.M. Chaudhary talks about the urinary organs, he tells us that the remedy is applicable in diabetes, albuminuria, polypi, and varices of bladder. So do you remember we also talked about polyp in nose and ear? Oh yeah, we also talked about polyp in uterus. So and now we're talking about polyps in bladder. So this is a common thing in Calcarea Carb. You will find this over accumulation of tissue forming a polyps, forming a polyp in Calcarea Carb almost everywhere. Then diabetes albuminuria. Now you already know that there can be many number of diseases which a remedy can cure, but only thing that has to be there should be the law of similia, right? It should be followed, the symptoms should match, and then the remedy will cure any condition. So now what are the symptoms of Calcarea Carb when we are talking about urinary organs? So there is a desire for urination which is frequent, okay, frequent desire for urination. The patient has to run past a few drops of urine several times within the course of an hour. So even in an hour the patient has to go many times. So that is how frequent the desire for urination is. After urination also there is tickling of urine, and there is involuntary urination on every motion. This is an important point and should be remembered that there is involuntary urination on every motion. Nocturnal enuresis may also be present. Yeah, they may present to you with nocturnal enuresis, which is nothing but a disorder in which there is involuntary urination during sleep or at night. So that is nocturnal enuration. Then urine is clear, milky white, or full of blood. But the important thing about urine is that it has a strong odor. The odor is so strong that Dr. N.M. Chaudhary says, once smelt, it is always remembered. So these are the words of Dr. N.M. Chaudhary. He says that if you smell it once, you will always remember. That is how much strong the odor of the urine is. So that's what we learnt about in urinary organs. We learnt about conditions in which it can be used, and polypi being the one you can easily remember. And diabetes, obviously, because diabetes has this symptom of polyuria, and then desire for urination. And you already saw that the patient has frequent urination, which is a symptom of diabetes, polyuria. Okay, polyuria meaning that there is the patient has to go many times, and there is a increase in the volume of urine. Okay, large amount of urine is being formed by the body, and therefore the patient has to frequently go for urination, and that is seen in diabetes, which is polyuria, and that is itself a symptom of Calcarea Carb. The patient has to go many times in an hour, and after urination, tickling of involuntary urination, every motion is seen. Nocturnal enuresis, urine has a strong odor. All right, then we'll go to pregnancy. So Dr. N.M. Chaudhary mentions many points related to pregnancy. Because this remedy is very very useful in pregnancy. Let's see how is it helpful. Okay, so first of all, Calcarea Carb helps in conception only. So even if conception is not taking place and pregnancy has not even started, pregnancy takes place only when conception is there, right? So even conception has not taken place. But why is it not taking place? If you go and check, okay, if you go and do USG and all the tests, and you see that all reproductive organs may be tolerable in good condition. So Dr. Ansori says this. So he means to say that all the reproductive organs are in good condition, there is no abnormality, and still the patient is not able to conceive. And basically we are clueless. Okay, doctors are clueless as to what is the diagnosis, why are they not able to conceive, why the patient is not able to conceive. But that may be actually due to some constitutional dyscrasia, meaning that there is some constitutional defect, some problem in the constitution itself, okay, which cannot be seen. There is no problem in the organs as such, but some problem in the constitution. And now when you give Calcarea Carb to this person, it will also cause conception. So how will you give Calcarea Carb to this person? Obviously you will see the constitutional symptoms of Calcarea Carb, the leukophlegmatic thing, the chilliness, the sensation of coldness of single parts, and many such points, right? We have already discussed those in part 1. So all those you can see, you can compare those to the patient, and you can see if the patient is constitutionally Calcarea, you can give Calcarea to that patient and it will cause conception. Okay, so that is the first point. Then he also tells us that when menses continue even after getting pregnant, so there is hemorrhage, there is blood loss even after pregnancy. Okay, then Calcarea Carb will check the flow, meaning will stop the flow and will prevent miscarriage, because obviously if after getting pregnant there is a lot of blood loss that takes place, it will finally lead to miscarriage. But now in these patients, Calcarea Carb, if you give them and if they're constantly Calcarea Carb, it will prevent miscarriage. Then cramps in toes and soles of feet during pregnancy. Now this, as you know, is a very common thing. Okay, it's a very frequent occurrence during pregnancy. These cramps in toes and the cramps of the sole of the feet, but they can also be helped with Calcarea Carb. All right. So we also find false labor pains in Calcarea Carb. So labor pains are there, but they are not true labor pains, meaning that they are not able to produce any effect. They are not able to actually lead to parturition. So these false labor pains will run upwards. Okay, they will run upwards, meaning the pains will be in this direction, when actually the labor pains uh, you should be able to push down the baby because of the labor pains, but the labor pains will be such that they're going towards your ribs. They will be running upwards, and unless stopped, these pains prove particularly deleterious and serve only to reduce the strength of the mother. So obviously they will reduce the strength of the mother. The mother has to go through all these pains, and they will particularly prove deleterious. They will not be of any effect, but it doesn't stop there. They may harm the mother as well. Now that was about the false labor pains. So we've already covered so many remedies, right? And we've seen how every remedy helps in a different way when we talk about labor pains. So that itself shows you we have so many remedies for labor pains with different kinds of indications, and we can actually help patients even in the operation room, even when they are being, they're delivering babies. So we should be doing that. We should be very confident about homeopathy. We should increase our skill set so that we can also prescribe in such conditions, right? And then we'll go to the next point, which is in phlegmasia alba dolens. So Calcarea Carb can be used in this condition, which means painful edema actually. Okay, it means edema, which is, you see edema on legs of the pregnant lady. So that is what they're talking about, that there is edema which can be painful. Okay, that is because of that the legs are also called as milk leg or white leg. See, this diagram or this picture also shows the same thing, that the lady is pregnant and her legs are like swollen because of the edema. Okay, and this actually is phlegmasia alba dolens is seen in pregnancy only, and it is seen in especially in the third trimester means the group of 3 months. A group of 3 months is trimester, and the third trimester of pregnancy actually has majorly shows this disorder or this disease. Basically it is nothing but edema in the legs, which happens due to the compression of the left common iliac vein against the pelvic rim, because the uterus has enlarged now. Okay, this is a pelvic rim. The uterus was small, tiny, but now it has enlarged because of the baby, and now it will push back and compress on the common iliac vein, right? And that will not provide a good flow for the blood over here. So there are veins over here, right? These veins will carry deoxygenated blood above to the heart, right, to pump it into the lungs and get oxygenated and again move back into the body. But now what happens is, because there is enlarged uterus and it is pushing on the common iliac vein, because the vein is now like flat, because the uterus is pushing onto it. So the blood, the deoxygenated blood from the lower parts of the body, from the legs especially, will not be able to move ahead, because the common iliac vein is now not providing the lumen for its movement. So that will give rise to this edema. The blood will be there in the veins, it will get collected over there only, not able to move ahead, and because of that serum and things will ooze out, and finally giving rise to edema. Okay, I hope you understood, but you'll understand it when you read in detail about it also. Now, the sixth point and the last point is that there is excessive or deficient secretion of milk that is seen in these patients, meaning I also have a diagram for it. So, there is galactorrhea, actually excessive secretion of milk is called as Galactoria, excessive meaning, actually it's called, it is galactoria is not excessive, actually it is like when a milk secretion takes place even without pregnancy. Okay, the female is not pregnant and still there is milk secretion through the breasts, so that will give, that is called as galactoria, not exactly excessive secretion of milk, but yeah, that can also take place, and deficient secretion of milk can also take place in patients. And at that time, if they are Calcarea Carb, if they have indications of Calcarea Carb, and you give Calcarea Carb, obviously the problems will get solved, right? And then we also see that sometimes, what happens, it also improves the quality of milk. So sometimes what happens that the baby is not drinking the milk. Okay, even if the baby is crying because he is hungry, but the baby still is not drinking milk. So what must be the problem? Sometimes the problem is the taste of the milk. So the taste of the milk is very disagreeable and nauseating for the baby, and that is why the baby doesn't want to drink the milk. Okay, now what to do in such conditions? Even in such conditions, if you prescribe calcarea to the constitutional calcarea mother, then the milk will get sweetened. Okay, that is we see the remedy act so deeply, it will sweeten the milk. That is what Dr. N.M. Choudhuri says. Okay, it will sweeten the milk, and now the same child will devour the milk greedily, will drink the milk greedily, which was the same thing what he disliked so utterly only a while ago. So see how beautiful it is. The quality of milk can also be improvised with the use of Calcarea Carb. That's about pregnancy. We talked about the false labor pains that take place when they move upwards. Okay, in phlegmasia alba dolens, which is the edema of the legs in the pregnant woman. We talked about the excessive or diffuse secretion of milk, about the galactoria, which also Dr. M. Chaudhary mentions how it can improve the quality of the milk. We also talked about about this conception thing, that Calcarea Carb helps in conception. We talked about if there is hemorrhage after getting pregnant, which Calcarea Carb will prevent miscarriage and cramps in toes and soles, which is a very common thing in Calcarea. Now let's go to the respiratory organs. So when Dr. N.M. Chaudhary starts talking about the respiratory organs, he tells us that this remedy is useful in all varieties of complaints, beginning from ordinary bronchial catarrh to even pneumonia and phthisis. Phthisis means TB. Okay, so whenever there is this word in our Materia Medica, phthisis, P see, this is the word. Okay, so see, I have already written it. So this phthisis, which it always means TB. Okay, remember this. So it has been said multiple times in our Materia Medica. So when this remedy can help in all varieties of complaints. So basic, some ordinary bronchial catarrh that the patient has, to pneumonia, to TB. Okay, and it particularly helps in chronic bronchitis when complicated with emphysema. So what is chronic bronchitis? Chronic means obviously acute and chronic. So chronic, and bronchitis means the inflammation of the bronchi, again because itis is there. So chronic bronchitis can also be there. So that can be there. And emphysema means there is this so it is a disease in which the alveoli of the lungs are inflated abnormally. So okay, they are inflated. So they are inflated abnormally. That is there. So this remedy can be used in any of these conditions, right? And then when we talk about the expectoration of this remedy, it is again yellow. So we've already seen a lot many things that are yellow. Pus is yellow, right? The expectoration which we're talking about now is yellow. The leukorrhea is yellow. So yellow and lumpy and sweetish. Now what is this? So Dr. N.M. Chaudhary says that now this expectoration is such then that when it is thrown in water, okay, when it is thrown in water, and it is falling inside the water, it resembles a falling star. It resembles a falling star, and this is because the heavier portion of the expectoration, while settling at the bottom, while it goes down and while it's settling at the bottom, it draws behind it a long trail of mucus. Okay, it draws behind it a long trail of mucus. So it looks like a falling star. So can anyone forget this symptom? It's so interesting, isn't it? We can never forget it. So Calcarea Carb has this kind of a expectoration which resembles a falling star when it's thrown in water, and it is useful. This remedy is useful in all the stages of phthisis, which is TB. So if the patient comes to you in a prodromal stage, there will be spasmodic cough, okay, and typical symptoms of calcarea. So what are the typical symptoms of calcarea? We've already covered those. It can be the leucophlegmatic constitution of the remedy, right? Or it can be chilliness, which we see in this remedy. They're very susceptible to cold, they cannot take cold. We can see the sweating of the, nape of neck, of the palms, of the head. Yeah, that all those things we have seen. So any of these symptoms, or some one or two or more symptoms of these symptoms as such are present in your patient, then these are typical symptoms of calcarea, and you can obviously prescribe calcarea. Okay, and then this was the prodromal stage. In the advanced stage, when large cavities have formed, especially in the middle third of the right lung. So this is your right lung. Yeah, this is your right lung. It has this apex, this base, this is the base, this is the apex. It has upper lobe, this is the upper lobe. It has a lower lobe and a middle lobe, upper lobe, middle lobe, lower lobe. This is the costal surface, the one which has ribs around it, and this is the medial surface, right? This is the right lung. So now he says that when large cavities are formed, especially in the middle third of the right lung, so he is dividing the lung again in three parts. In the middle third, that is again the middle lobe only. So if the middle lobe is getting affected, right middle lobe, then and you have calcarea like symptoms, that can again indicate you towards calcarea. So if you have calcarea like symptoms, okay, the typical symptoms of calcarea are present. So you are very much, you're thinking that, yeah, this patient must be calcarea. But now when you see the reports and you find the middle third of the right lung is involved, you're very sure, and because you've got this peculiar point, you're very sure that, yeah, it has to be calcarea, because this is present with the typical symptoms of calcarea, right? Okay. So that is what we saw until here. Now, what does Dr. N.M. Choudhuri say? He says that before closing, I would like to emphasize on a piece of caution which has been dropped by Hahnemann. Okay, which has been dropped by whom? By Hahnemann himself. He says that this remedy should not be used before nitric acid or sulfur, as it is likely to bring on unnecessary complications. So if you have given Calcarea carb, you should not after that give nitric acid or sulfur, because it will bring on unnecessary complications. All right. So what did we see in respiratory organs until now? We saw that the expectoration is yellow, lumpy and sweetish. Yeah, we saw that there is long trail of mucus when it's falling inside the water, so it resembles a falling star. It is useful in all stages of TB. Prodromal stage has spasmodic cough plus typical symptoms of calcarea. Advanced stage has this middle lobe of the right lung getting involved, and N.M. Choudhuri says that you should not give nitric acid or sulfur after giving calcarea. All right. Now let's move ahead to talk about the fever of the remedy. So this remedy is indicated in intermittent fever, and after that we will also study how it is indicated in typhoid fever. So first let's talk about intermittent fever. So in intermittent fever, there's prodrome stage. So what is prodrome stage? So basically every fever will have, so fever normally has, but not every remedy will have all the three stages, but fever normally has three stages, which is heat, chill and sweat stage, right? Heat, chill and sweat stage. You should remember this. And what is prodrome? So it is something which happens before your actual fever starts. That is, these three stages start. So before these three stages, what happens is what comes under the prodrome. So sometimes you feel that now fever is going to come. You feel that already. So that is a symptom of your prodrome. Okay. There can be many symptoms, like some people will feel the whole body is aching, and they now say that because my whole body is aching, I can feel it that now I'm going to have fever. That stage is actually prodromal stage, in which you will have a few symptoms before the actual fever takes place. So what are the prodromal symptoms that we find in Calcarea carb? So in Calcarea carb, there is a sensation of drawing pain in all the joints and great heaviness of the head and the limbs. So see, there is drawing pains, which means that there is khichao. Okay, so drawing pains in all the joints are there. So joints will pain, and there will be great heaviness. This is a very important point in Calcarea. As we will go ahead, as we'll talk more about the fever, you'll understand about this heaviness, which is very important. So first of all, in prodrome, there will be joint pains. Okay, joints will pain, and that will be a drawing kind of pain, and there will be great heaviness of the head and the limbs. This will be the prodrome, and then starts the chill, or what happens in the chill. So it begins in the stomach. So first of all, the chill will be felt in the stomach in this patient. Okay, now every remedy has different kind of symptom. Okay, every remedy will have that the chill begins in the sole of the feet, the chill begins in the hands, or the chill begins in this and that. So you every remedy has such kind of symptoms. So now what Calcarea has, it begins in the stomach. Okay, chill begins in the stomach. What is the chill accompanied by? It is accompanied by an ongoing sensation of weight. See, I told you, great heaviness, the sensation of weight is very important in this remedy. So again, this agonizing sensation of weight has come up, right? There is this weight, this sensation of weight will increase with chills and will go on decreasing with it. So increasing with chills and decreasing with it, that is seen. Okay, as the chills will disappear, this sensation of weight will also disappear, which started in the prodrome and which was there all along the chill stage, and now after the chill stage this symptom will go off. There is icy coldness of limbs. The patient finds it very difficult to get them warm even if they are covered warmly. So this is what we've seen, right? There's sensation of coldness in this patients. A single pass में sensation of coldness is there. So limbs में now they are saying that in the chill stage the limbs will be icy cold and the patient will find it very difficult to get them warm. They will cover it with a lot of coverings, but still the part will not be feeling warm. Okay, it will be icy cold only. Then comes the heat stage, in which the patient is thirstless. There is no thirst in the heat stage. Great orgasm of blood, so the blood gets collected in one place. There's flow of blood to this place, gives a sensation as if the patient had been drenched with hot water. So much of blood is coming to, so much of flow of blood is there that this patient feels that as if he had been drenched with hot water. Now you see that in the chill stage he was feeling this icy coldness of limbs, and now in heat stage he is feeling as if he has been drenched with hot water. So how contradictory. So just now in the chill stage he was feeling cold, and now he's feeling very, very hot, right? So that's how it is. So even the fever of Calcarea is very characteristic. It can be remembered. It is not something very vague, and because it has some symptoms, interesting symptoms, and that will help you remember this. So there is this pain first of all in prodrome in the joints, and there is great heaviness. You should remember this heaviness wala symptom because it lasts even in the chill. So even the chill begins in stomach, and then it is accompanied with this too heavy wala sensation. There is agonizing sensation of weight, increasing with the chills and decreasing with it. Icy coldness of the limbs, and the patient finds it very difficult to get himself warm. The heat will be in the heat stage. The patient will be thirstless, and there will be great orgasm of the blood, and because of which the patient feels that he has been drenched with hot water. Now let's move to the next stage, which is the sweat stage. The sweat stage is also thirstless. The patient is also thirstless in the sweat stage. But yeah, we've missed one point from the heat stage, which is that during this period he is tortured with anxiety. So there are few mind related symptoms in the heat stage. He feels that he is tortured with anxiety. He is in heavy again this word comes up, heavy. So see, the authors use these words not only like that. Okay, they have thought something behind it. So there is heavy despair regarding his life, which he finds difficult to shake off. Okay, in spite of all his determinations to do so, he will feel despair, he will feel sad about his life, he will have this grief about his life, and he's tortured with anxiety as well. Okay, that was the fever of the remedy as we've spoken about it. And then he mentions one point saying that the constitutional symptoms of and the soric cachexia should never be lost thought of in the selection of Calcarea Carb. So you watch that the patient has a few symptoms, like maybe he has this chill which begins in stomach, and maybe he also is thirstless during heat and sweat, and you think that yeah, these symptoms are there in Calcarea Carb, let's give Calcarea Carb. So that is not what you should do. First of all, you should have one or two characteristic symptoms present in your patient, and he says that the constitutional symptoms of Calcarea Carb and the soric cachexia, meaning the even if he is fat flabby, he is emaciated. So that emaciation, okay, that lack of nutrition and the constitutional symptoms of Calcarea should never be lost thought of. You should never forget about them when you are selecting Calcarea Carb as a remedy for your patient. Okay, if they are present, then Calcarea Carb is a good remedy to be thought of. Now we come to typhoid fever. So now whatever we talked about right now before typhoid fever was about intermittent fever. Now let's see what is there in typhoid fever. So in typhoid fever, Calcarea Carb is indicated at its very onset, okay, when it starts. And the symptoms over here are that there is utter sleeplessness in this remedy. In typhoid, there is sleeplessness due to what? Due to overactivity of mind. overactivity. So we've seen this when we were discussing about mind. There can be complete blankness, complete confusion, and there can also be overactivity. We've seen this when we were talking about this. We also mentioned the other remedies that are present, also present with overactivity of mind. And the other remedies were opium, right? We talked about opium, nux, we also talked about bryonia. Yeah, all these remedies also have overactivity of mind. And they now in this patient, the overactivity of mind is due because of the sleeplessness, and he finds no rest because of some disagreeable idea. He has some disagreeable idea in his mind. We also saw in intermittent fever the mind related symptoms, right? He had this heavy despair. Now here also he has some disagreeable idea which always keeps lingering in his mind and which keeps rousing him. Okay, as soon as he falls asleep, it will rouse him because there will be this disagreeable idea in his mind which will wake him up, and he will find no rest because of that, and sleeplessness because of that, because there are these thoughts, there is this overactivity of mind that will not let him sleep. Now, in this typhoid fever, he also sees horrid visions before his eyes. Horrid visions, okay? Horrid. Very scary visions before his eyes. In the delirium, he will play with cats and other animals. He will talk about fire, mice, and murder. Fire, mice, also murder, okay? Somebody is killing someone with a knife or something. So he talks about all these scary things because he's actually scared of all of it. Okay, fire, mice, and murder is nothing but something that symbolizes scary things, right? These are scary. Fire will scare, murder will scare you, fire will scare you. Mice, yeah, mice, not such a cute mice, but not only mice can also scare people. So these things will scare Calcarea Carb. She is afraid of these things. Okay, and that will be seen in the delirium. She will talk about all these things because that is her fear coming up. Okay, and then there is palpitation, meaning that the heartbeat is increased and that you can feel it. A tremulous pulse will be there. Anxiety, exhaustion, and weakness are determining symptoms. So all of that. So basically, this is an important symptom in this. Horrid visions will be seen. So that was about the typhoid fever of Calcarea. Next, we go to epilepsy, which means convulsions. Okay, in convulsions, there is this aura. Aura means again, like we saw prodromal in fever, that is something which happens before actual fever takes place. In the same way, in epilepsy, aura is there. Aura means before the actual epilepsy symptoms take place, something that happens is aura. So in aura, the patient feels as if something is running through his arms from the pit of the stomach down through the abdomen into the feet. So there's something which is running through all these things, all these places. That is the arms, pit of the stomach down through the abdomen into the feet. Now, what is the ailments from? So ailments from is idiopathic. We do not know why is this happening actually. But when you go and see from when you take the case and you study the case in detail, you'll see that maybe vexation, that is which means annoyance. Okay, getting very annoyed, getting very worried, that fright, onanism is masturbation, suppression of chronic eruptions. These might be the causes because you see that all these things, one of these thing took place in that patient's life, and then the patient has started getting epilepsy attacks. So it's clearly the ailments from for this epilepsy, right? But you cannot, like, there are no such tests or anything that you can do and you can find out what is the cause, because there is no cause actually which was being seen in this patient when you look at it from the modern medicine point of view. But these can be the causes because after this epilepsy takes place. Okay, so that is all that he talks about epilepsy. That is all that Dr. N.M. So he tells us about epilepsy, and here we complete talking about Calcarea Carb finally in the part 3 of Calcarea Carb. Now let's go and revise all of that so that we can remember it in a better way. Okay, so when we started talking about Calcarea Carb today, we talked about first of all the urinary organs, yeah, in this remedy. In the urinary organs, we talked about the application of this remedy, which can take place in diabetes, right? Diabetes is a condition in which because there is polyuria, right? And we also saw that polyuria, and we also saw that. Okay, so we also saw that this is a very important symptom in Calcarea, that is that there is frequent urination. In 1 hour, they will have to go to urinate many times, right? There is frequent urination in this remedy. And then there is another thing which we saw, that this can be used in albuminaria and in polypi or varices of bladder, where we discussed about the polypi thing, and then we moved on ahead to talk about the symptoms which take place after urination. Also there is tickling of urine, right? After urination also the urine keeps sticking on. And then there is one important symptom which we talked about, that is involuntary urination, right, which took place on every motion. Then we also talked about nocturnal analysis which may be present, and in urine we talked about an important point, that the urine has very strong odor, right? Once smelled you can never forget it. Then we went on to talk about the pregnancy related symptoms. In the pregnancy related symptoms we talked first about conception, right? So this remedy helps in conception. If there is no problems in the urine in the reproductive organs, but still the patient is not able to conceive, which may be due to constitutional dyscrasia, then Calcarea Carb can help you in that. Then we also talked about hemorrhage, right? Hemorrhage which continues to take place even after getting pregnant, even after pregnancy. Okay, so in these conditions Calcarea Carb will stop the blood flow and will help you in preventing miscarriage. We also talked about the cramps which are very common in pregnancy, cramps in toes and soles of feet. Yeah, and then we talked about an important point, which is false labor pains. In false labor pains we saw that these pains actually run upwards. Yeah, so these pains run upwards and they will be deleterious to the mother and will reduce the strength of the mother and not effect at all. And then we talked about an important point again, which was this phlegmasia alba dolens. You need not remember this, okay, for exams especially. It actually means edema of feet. You can write that only, the edema of feet in pregnancy. Then there can be galactorrhea, right? There can be this galactorrhea which we talked about. There can be excessive or deficient secretion of milk, isn't it? Then we talked about a very beautiful point, that it can also improve the quality of milk. So if the baby is not drinking the milk, even if there is no other issue, the milk may not have a good taste, it may be disagreeable and nauseating in taste, and therefore the baby is not able to drink it even if he is hungry. So if you give Calcarea to this patient, it will sweeten the milk, and but not to any patient, okay? Obviously the Calcarea symptoms must be present, typical symptoms Calcarea must be present. Then we went on to talk about the respiratory organs, right? In the respiratory organs we also discussed about an important and very interesting point. First of all, that the expectoration is yellow, lumpy and sweet. Okay, so expectoration of many remedies, are told to have different tastes, which is also very important, right? Many because we have very various tests, and we can that is also an indication to any remedy. If we know the taste that the patient has and know the remedy that has the taste, we obviously know that this remedy can be maybe helpful in this case. Then we saw that this expectoration of Calcarea Carb, when you throw it in water, it falls like a star. So it looks like a falling star, because you saw that this was a mucus, and the mucus will have kind of like these trails it will leave behind when it was falling, right, in the water. Okay, so if you want to see the diagram, let me show you. So it will look like this, right, when it's falling in water. Okay, then we talked about the things like, let's discuss over here only. We talked about TB, in which there is prodromal stage and advanced stage. In prodromal stage, the spasmodic cough is there with typical symptoms Calcarea. There is leukophlegmatic, chilling and sweating palms. Advanced stage, there are large cavities which are formed, especially in the middle third of the right lung, right, middle lobe of the right lung. And then Dr. N. Choudhuri says that this remedy should not be used before nitric acid or sulfur, because it will cause unnecessary complications. So let's not write this part now, because we've already discussed it now. So let's move on ahead, and we talked about fever of this remedy, which can be used in, it can be used in intermittent fever as well, and typhoid fever. You know that typhoid fever is actually a continuous kind of fever, so when you have it, it will go on continuously. But intermittent means it is there now and it is not, for some period of time it will not be there, then again it will come on and it will not be there. Intermittent fever, we saw that there are various stages like prodrome stage and chill stage and heat stage and sweat stage, right? And prodrome, we saw that joints were painful, drawing sign of pain was there, and there was great heaviness which was felt in the limbs and the head. In chill also, we saw that this heaviness, that this sensation of weight continued, and it will increase with the chills and it will decrease with the chills. There is this there and there was this icy coldness, right, in the limbs, especially whatever you do, it is not, the limbs are not getting warm, and the chill was beginning in the beginning through the stomach, right? Yeah. And then the heat stage came, where we talked about that the patient is thirstless during the heat stage and he feels like he has been drenched with hot water. Then we talked about the next stage, which is sweat stage, again, which was thirstless. See, I again missed the same point which I had earlier missed, that in heat stage there is also mental symptoms, there is mind related symptoms, that the patient feels anxiety and despair, right? Then we saw that this remedy should never be just given. You should see the constitutional symptoms and the zoic cachexia before thinking of Calcarea Carb. Then we went on to talk about the typhoid fever. And in the typhoid fever, what did we talk about? We talked about the sleeplessness of this remedy. Sleeplessness, which is mainly because of the overactivity of mind. Overactivity of mind, and this overactivity mind also can be seen in opium, nux, and bryonia, and because of that there will be a disagreeable idea which will stay in the patient's mind and he will keep on thinking about that. Then this patient has horrid visions in typhoid, right? He will talk about what? Talk about mice, fire, murder. He will talk about fire, right? He will talk about murder, mice, and murder. Okay, so that's what he will talk about. Then we've also seen that he will play with cats and animals during this time. He will have this palpitation, vagara vagara. And then we also talked about epilepsy, which I will write here only. So we talked about epilepsy also of this remedy. In epilepsy, we saw that the first thing is that the patients have aura, and in the aura there is a sensation of something running in the arms, in through the pit of the stomach, abdomen, and then there were ailments from which was idiopathic actually, but there can be vexation. The patient can be very frightened, because of which they get epilepsy. They may be masturbating, and the bad effects of masturbation may be epilepsy, that is onanism, and they might have suppressed some eruptions that they had chronically present. Okay, suppression of chronic eruptions they might have done through steroids or naturally or through any kind of ointment. So that is what we learned today. So I hope that you can revise it through this in one page itself, whatever we've learned today. All right, so that's all for Calcarea Carb. We've completed talking about this beautiful remedy. Finally completed talking about this beautiful remedy, which is Calcarea Carb, and it is a polycrest, it is a constitutional remedy, and it has a wide range of action over so many things, right? So many organs and all over your body, right? So that's about it. Let's come back and meet for when we're discussing about some other remedy. Okay, so bye.